Okay, welcome. I wanted to talk about a case that I just saw and treated about an hour ago. A patient came in for tooth number 9, having an aching pain, was sore, tender. We take PAs. Tooth number 9, she's pointing to tooth number 9. You look on the PA, you can kind of see something at the apex, but you're unsure. The other PA didn't help much. Something might be going on, but it's a virgin tooth. It's got a little filling in there, virgin tooth, but it's worn down, okay? So the key is I take a CBCT. Even though it's an anterior tooth, I take a CBCT, and I just want to show you what I see on the CBCT. When I took the CBCT, I don't know if you can see it. Can you zoom in on that? You can see a clear radiolucency, clear periapical radiolucency on tooth number 9, and it tested sore to percussion, no response to cold, tested necrotic. The key here, though, is if you look closely at this tooth, this case, there's no canal until you get into the middle, really the apical third, okay? And so I told the patient from the get-go, this is going to be a tough one, okay? I'm going to have to access this tooth. I'm going to have to slowly work down the canal, work down the root to try to find that canal. The key when I did this was I took my time. It was difficult. It probably took me about 15 minutes to find the actual canal. But I followed kind of that yellowish calcification. And I used surgical length round burrs, half round burrs, quarter round burrs. I used months burrs, okay, if you know what those are. And I used small ultrasonics. I had to go to ultrasonics once I lost sight of my actual drills, because you want to be able to look where you're drilling. So I use the ultrasonic tips, an Endo 4 from Dentsply to just slowly work my way down. Make sure you don't drift too far facial. That's where you'll go. You'll go facial and you'll start to go too far. I stayed the path and I found it, and it's usually, canal's always going to be a little more palatal or lingual than you think. So just keep that in mind. Kind of an interesting case I wanted to share. Thank you.